Hi, I appreciate you joining me for this webinar this afternoon. This is Mike Wines. I'm going to discuss some of the biomechanical and physiological considerations within periodization, some joint-by-joint approaches to training, and how that will affect our program design. A bit of background on myself. I recently received my bachelor's in exercise science from USC, the real USC in South Carolina. As such, I also did 3 undergraduate internships during that time with Exos, formerly known as Athletes Performance, the strength and conditioning department at USC, working with a variety of our sports teams, and also with my current employer, Athletes Arena. Those 3 internships combined totaled for 1,300 plus hours. So what am I doing now? I'm an author and content contributor at Muscle and Strength, and if you're interested in reading some of my articles, you can simply Google my name, plus Muscle and Strength, and find all of my contributing work on there. I'm also a strength and conditioning coach at Athletes Arena, where I had my last internship, and I plan on getting my master's in exercise science with a specific emphasis in strength and conditioning in August of 2015. So, now a quick little background on periodization. I'm going to talk through some of the basics so that we have a general understanding before getting into a bit more of the specifics. Periodization as a whole is simply the manipulation of certain variables within an athlete's competitive season to peak them for a certain event, whether it be a powerlifting meet or their sport season. Now you might manipulate volume, intensity, sets and reps, and frequency, as well as the duration of the lift throughout their year. It's typically broken up into 3 phases. You have your macro cycle, that's your yearly divisions, the whole 52 weeks. You have your mesocycle, that's each individual weekly division. And it can be anywhere from 21 to 31 days. You got 7 basic phases. Each coach is different. They'll use different names. This is just what you might see on a macro cycle. And then you have your individual microcycles. And that's your daily or weekly divisions, anywhere from 7 to 14 days. So an entire macro cycle might look like this. This is something that I outlined for the golf team at USC when I was there. It's broken down at the top with their competitive season overall, their home and away matches. Below that, you'll see what we're specifically emphasizing within training, what phase we're in terms of mesocycle. And then you'll also see that we have specific peak weeks here in black and then recovery weeks here in blue. So that would be your deload week following by your higher intensity peak week. Move down a little bit, you see that their conditioning is here. A little bit of an aerobic base work initially, moving into more anaerobic work, and then we maintain that throughout the season with more circuit style training, plyometric, technical and tactical work, and finally at the bottom, this is the intensity of lifts that they're going through. It's also correlated in colors with a specific phase, so we'll go through individual mesocycles later, but that's typically how a macro cycle might be set up, especially at a collegiate level for the entire year, to give a breakdown for that team. Now, an individual mesocycle, this is a template that I built for my online athletes, and it includes both exercise movements here, sets and reps. They can enter in the load that they use, and then coaching cues over here. It also would have YouTube videos linked here in case they had questions. But the coaching cues are essentially for them to use in my absence. So the entire mesocycle is then 4 weeks, and then when we go into microcycle, that would be an individual week out of that mesocycle, just to give you a typical breakdown and what it might look like. Now, whenever we start strength training, you always have central nervous system adaptations. Initially, those start out and they're very, very frequent, and then over time they dwindle, but we're still getting adaptations. So in order to understand program design, we have to understand kind of what's going on physiologically. So with any form of periodization, we know that your initial strength changes within the first 2 to 8 weeks are completely neural, meaning that your central nervous system improves coordination, firing patterns, and neural efficiency in order to allow you to lift the weight in the most coordinated manner possible. So we're not actually getting an increase in cross-sectional area. We're not getting any sort of hypertrophy response. But with that time, you have to remember that you're still going to improve strength levels based upon your central nervous system improvement. The size principle. Size principle is essentially the idea of motor unit recruitment, and it's evidenced by this picture on your right. Whenever you're lifting weights or whenever you're doing any sort of movement, you have to go through this order, essentially. You go through type 1s and into type 2s. And it's beneficial in that type 1s are very, very low fatigue. So that's what you're going to use on your day-to-day movements, whether you're walking around, getting in and out of your car, things of that nature. Type 2 is very, very high power output. They fatigue a little quicker than type 1, but again, that's what's going to give you the ability to deadlift maximally, to squat maximally, and to also improve speed and agility, change of direction, things of that nature. But the size principle states that essentially in order to get to those type 2 fibers, you got to go through the type 1 fibers. So that takes a little bit of time. That would be the importance of warm-up sets and things of that nature. But with our central nervous system adaptations over time, there's rare instances where you could actually alter this size principle to where you could recruit type 2s much faster than the average person. And this is typically seen in speed and power dependent exercises. So if you had an Olympic lifter, an elite lifter, who came in fresh off the street, no warm-up sets, no dynamic warm-up, and they went straight to snatching 225 or cleaning 315. It's possible, but again, it takes that central nervous system adaptation over time. Now, rate coding. Rate coding is essentially what it sounds like. It's the rate at which your motor units are fired. So with this, we know that in order to do a small amount of work, you're not going to recruit all of your motor units. Obviously, it makes sense. Your body wants to be as efficient as possible. So in order to lift a maximal weight, your body might recruit a smaller number of motor units than is necessary. Again, as we improve that central nervous system adaptation, you would get better rate coding and more motor units fired to improve the efficiency of the lift at a specific weight. We also get a slight amount of fiber type conversion. Typically, though, it's type 2X to type 2A. You're not going to see a whole lot of type 1 to type 2. This is mainly due to the fact that fiber type is controlled by the nerve that innervates it. If you look at research on this subject, they took type 1 fibers and they surgically removed those nerves from the type 1 fibers and they attached them to type 2. Well, what happened? The type 2 then actually became type 1. So it's possible to get that conversion, but within training, you're not actually surgically removing nerve fibers and connecting them to other muscles. So it's very, very unlikely. Now, we also get, as I mentioned before, improvement in the efficiency of the movement. And this is what's typically referred to as motor learning or technique in layman's terms. I mean, you'll see it often with beginners. They're very, very shaky. They can't maintain certain positions, and they don't understand kind of proprioceptively and kinesthetically what positions they should be in within certain movements, whether it be hip hinging, and they can't differentiate movement at the hips versus movement at the spine, or squatting. They can't differentiate kind of lumbar hyperextension versus hip flexion, things of that nature. However, over time, what you're going to find is that you're going to get less contraction of opposing muscle groups, and that's going to correct improper position. So for example, if you have a beginner, you're teaching them to squat, and every time they reverse out of the hole, so eccentric into concentric movement, they get a valgus knee collapse. The knees move inward. Well, over time, what you're going to find is as they improve co-contraction of their glutes with their adductors, they'll get less of that valgus knee collapse, and the glutes will fire to inhibit that valgus knee collapse and keep them in a more stable position within the frontal plane. You're also going to see decreased neural guarding. So we know that the main goal of your central nervous system is protecting you against injury. And two of your most vital organs internally, well, not organs, but we'll say internal components are your spinal cord and your brain. So anytime we're loading them, axial loading, or we have a whole lot of shear stress upon them, think squats or deadlifts, your CNS is going to generate a huge output from that. However, during training, we're also influencing two specific mechanisms known as your Golgi tendon organs and your muscle spindles. Now, Golgi tendon organs are inhibitory in nature. They also convey tension changes. And so when you get this large tension change within a muscle, and it's stretched to the point where you might actually cause injury, what happens is the Golgi tendon organs fires and it shuts off that muscle to prevent you from actually injuring yourself from the muscle developing too much tension and pulling a tendon off the bone or something of that nature. Now, muscle spindles, on the opposite hand, are actually stimulatory in nature. You see these with Olympic lifters when they're squatting. As they go down to parallel, it seems like they have a lot of tension. Once they pass parallel, it actually looks like they almost bounce out of the bottom. And they're not actively bouncing out of that position, but they're also just letting their muscle spindles take over that position. So the muscle spindle, when it's excessively stretched, what it does is it then contracts. So once they get past that position of parallel and they go below 90 degrees, what's going to happen is that muscle spindle is going to be excessively stretched and it's going to fire to give them that bounce out of the hole. So going back to our neural guarding topic, as training improves and we get these adaptations, we see a decrease in the Golgi tendon organ output and an increase in your muscle spindle output. So you're going to get less inhibitory output from your Golgi tendon organs, which means it's going to shut off those muscles less, and you're going to get more output from your muscle spindles, which means you're going to get better contraction when they're stretched beyond their normal rate. So now that we kind of have a background of what's going on within the body, the question remains, how do you formulate the best program for your clients' goals that they're actually going to enjoy? So we've talked some of the science, but there's also an art to programming, and that's not really learned within a classroom or within a textbook. That's something that comes with experience and just working with folks and getting different athletes and different opportunities. But here's a few things to keep in mind. When you're programming, you got to work backwards. So you got to determine your goal and where you want to get to in order to determine the necessary steps to actually get to that goal. It's kind of like when you're driving somewhere, when you're going on a road trip, you have to actually know your final location in order to determine which highway and which roads to take to get there. Same when you're setting up program design. You also have to remember that the best programs are the ones that are going to give your clients what they want, but also what they need. And that's what you are going to determine with your initial evaluation or your assessment of them. So as a coach, you're going to see biomechanically and physiologically what is happening within the body, whether it be compensation patterns or specific energy systems that need to be developed. But you also got to realize that this person is an individual and they're going to have specific likes and dislikes, as well as certain exercises that they may enjoy more than others. Take that into consideration when you're writing their program. So, as I mentioned above, let's look at lifestyle choices. Are they a high-stress person? Are they typically sympathetic, stressed out a lot? Do they have a long commute to work? Are they a surgeon or a lawyer or things where they're dealing with these very, very high stressful situations? That's going to determine recovery. It's going to determine training frequency and duration. And it's also probably going to determine volume as well. Look at likes and dislikes. If you have an athlete who is squatting 3 times a week, but they absolutely hate squatting, then that's probably not the right program for them. It's going to definitely influence their long-term consistency with the program, and overall sustainability is what's going to keep you in the sport. So take those things into consideration. Let's look at current motor patterns. If we got a baseball player who can't hold a bodyweight lunge, then we've definitely got an issue there. He's a baseball player, right? He's on one leg all the time essentially. But if he can't hold a bodyweight lunge, then what's he compensating with within his sport? Prior injuries. If you've been in a boot for a while, we might have some right to left asymmetry issues going on there. We might have some glute dysfunction on the leg that had the boot in it. Things of that nature. Let's look at sport-specific demands. We know that in golfers, lack of internal rotation on the front leg is typically a predicator of injury potentially at the hips. So let's look at specific mobility patterns that we can put in to enhance that internal rotation. Let's check it within the initial assessment. If their goals are fat loss related, but you have them doing 10 minutes of breathing work, 10 minutes of mobility work, and you got a 45-minute session with this person, they're probably not going to get to their goals very quickly. Take that into consideration. If they don't want to be bothered with a very long warm-up and all of the details that go into that, take that into consideration. Maybe they don't need a super detailed program. Maybe they just need the basics. And finally, the physiological response to training differs within each person. We know that there's a genetic component, and as such, you can put 2 people through the exact same program, and one will have completely different results from the other. And that's entirely due to their genetic response to that training protocol. So we know that volume typically is a determinant of hypertrophy as well as strength. So in the literature, what we've seen is that 3 sets is typically superior to 1 set, and 5 sets might be even superior to 3 sets. However, on an individual basis, this could be incorrect. If you have somebody that has very, very poor recovery capacity and perhaps they can't handle a whole lot of volume, then 5 sets is definitely not going to be what they need, and perhaps they'd be better ramping up to 1 top set, pyramiding up to that set, and then continuing on with their accessory work and going home, limiting the amount of CNS fatigue that's occurring within that set. All things to keep in mind when writing programs. Now, we're going to discuss some of Brad Schoenfeld's work, and this is very, very important in program design and understanding, especially if hypertrophy is the main goal. Brad is an assistant professor at Lehman College. He's also an NSCA affiliate. So if you're interested in his work, you can Google his name, and much of his work will come up, and you can read through that a bit more. But we know that we have 3 mechanisms for muscular hypertrophy. Our first being mechanical tension. And this is essentially the amount of weight that's actually on the bar when you're lifting it. This is king in terms of producing muscular adaptation. This is the number one thing that's most important. We know that strength and conditioning is built on progressive overload. So obviously we're going to have to increase that weight each time or improve the amount of volume that we're doing with that. Always remember though, everything is based around mechanical tension. The next component is muscular damage. And this is beneficial, but it adheres to the bell curve. And if we remember the bell curve, you got 60% in the middle and 20% on one side and 20% on the other side. So within that optimal range, most are within that 60%, but if it can be overdone to the point of, think, rhabdomyolysis, where you essentially get excessive cell swelling to the point where they actually burst, that's that upper 20%. But it can also be underdone, and this is typically exhibited, or it was typically exhibited, in the powerlifting population. And finally, last but not least, we have what's known as metabolic stress. And metabolic stress is essentially the accumulation of specific byproducts from energy systems while you're lifting. And this can be anything from hydrogen ions to lactate to phosphate and many other byproducts. Now, you're also going to get cellular swelling with this. And this is what's known as the pump. Everybody's chasing the pump. It's also been shown that it's maximized by glycolytic training plus the addition of creatine monohydrate. Now, going back to cellular swelling, what is actually occurring there, and is it actually beneficial? Does the pump build muscle? That's really the main question. And if we look at the body's main desire, your body's main desire is always maintaining homeostasis, keeping the current condition and not allowing that status quo to deviate from the norm. Now, when you get cellular swelling, what's going to occur is an anabolic response within the body is actually triggered to fight against what's known as apoptosis. Now, apoptosis is typically self-programmed cell death, and the cell will actually rupture and destroy itself. Now, with cell swelling, what's happening is those cells are absorbing intercellular water and swelling to the point where they're almost rupturing. But it's actually anabolic in nature because now the body is improving the strength of those cells so that the next bout of cellular swelling won't cause rupturing. But when we go back and we look at how it's maximized, creatine, everybody's talking about creatine and water retention. People say, oh, well, creatine causes me to gain weight. And really that quote-unquote weight gain you're just seeing is actually water retention. So it's transient in nature. But there's a reason why that water retention is beneficial. So if you increase water retention, and you think back to cellular swelling, if we increase the amount of water retention, what's happening is then that water can then be absorbed and increase cellular swelling for a bigger anabolic effect. So creatine not only helps enhance that adenosine triphosphate resynthesis within the phosphagen pathway, but it also helps enhance cellular swelling mechanisms. Now, Schoenfeld also notes within his training that above a maximal threshold for tension-induced hypertrophy, you have to remember that metabolic factors become more important than additional increases in load. So, once we've hit a certain mechanical tension, 80 to 85% of our 1 rep max or a little bit higher, it becomes more important then to look at metabolic factors, not muscular damage, but metabolic factors rather than additional increases in the load for mechanical tension. Now that's within an individual session. Don't overthink this and think this is within an individual meso or macro cycle. This is talking about one individual session. Once you've hit that maximal tension threshold, it's better to then focus on metabolic factors. So from this, we can conclude that it's better to set up your intensity first within your lifts and then transition into more volume style training. This can be accomplished with blood flow restriction training. If you're interested in that, you can look up Jeremy Lenicky. He's one of the main researchers behind it. Blood flow restriction is essentially the idea that you're applying a tourniquet to a muscle to resist venous blood flow back to the heart, but still allow arterial blood flow into the muscle. So you're increasing that buildup of metabolic byproducts and thus enhancing metabolic factors. Supersets, here you're just supersetting whether it be agonist or antagonistic muscle groups to improve time to fatigue as well as those metabolic factors. Drop sets, same idea. Hit a weight, certain number of reps, drop the weight just a little bit to continue with the reps, hit the weight, hit the reps again, and then drop it down one more time, depending upon the number of drops you want. And it's similar to training to failure in that you just come shy of failure. And finally, last but not least, this is used by many people. It's fairly straightforward, just training to muscular failure. This would be much better on accessory work rather than compound work due to the amount of CNS fatigue that it generates. Now, so you have a client that comes in. Where do you start? Well, all programming has to be built upon an initial evaluation, both postural and performance evaluation. So always use the motto assess, don't assume. You don't know what's going on with folks, even when you're looking at them within a standing posture. They could be compensating for a whole host of different things within their general motor patterns. And if we look at general motor patterns, we got to think squat, hinge, push and pull, both horizontal and vertical, carry, lunge, sprint, and crawl. I mean, that's essentially all of your basic motor patterns that you're going to go through within a training program. So looking at each of those within your initial evaluation is going to be beneficial to determine, is that person compensating through a squat? Do they understand how to pull, do a horizontal row without getting anterior humeral glide of the shoulder? All little things like that in seeing what the person understands from a biomechanical standpoint. Now, let's think physiological here. FMS would be more of a biomechanical screen. That's the functional movement screen. They have a medical version or a industry version of that, which is the SFMA. But if we look at individual joint range of motion, that would be included within biomechanical. Breathing patterns, though, that gets into more of the physiological, and we'll discuss that more coming up. But then if we look performance, we might look at broad jump, vertical jump, 20, 30, 40-yard dash, or even a VO2 max test to see how well the athlete is able to utilize that oxygen that they're bringing in with each breath. And finally, once you've assessed, you got to figure out how to correct that. Because we know that with each assessment, we're actually looking at the weak links within our clients' or our athletes' kinetic chain. And really, you're only as strong as your weakest link. So if you have very, very strong glutes and hamstrings, but you have a very, very weak anterior core, then deadlifting is probably going to be very, very tough on you, and you may actually generate some back pain for yourself in that you're not able to resist the pull of that weight getting you into flexion. But over time, once we've assessed this, now we look to correct it. Many people use the term regressions. I'm not a big fan of that term, as it generally has some negative connotations. If you have two athletes and one is able to back squat and you say, oh, I'm going to regress you, the one that can't back squat, to a goblet squat. Well, he's generally probably not going to be okay with that because his buddy's back squatting, but he's not. So I like to use the term pregressions. You're preparing someone essentially to do the movement. So say, I'm going to pregress you to a back squat or to a goblet squat. So now we're still training the squat pattern, but maybe we're just not training a back squat. We'll get to the back squat with our progression, as evidenced by our next point, but right now we're kind of preparing you for that back squat pattern. So always be mindful of how you're terminology is actually coming across to your clients and athletes, and what sort of response that's generated within them psychologically. Now, here comes the fun stuff. All right, so breathing. What's the point? Breathing, everybody breathes every day. Yeah, you're taking in 15 to 20 breaths a minute. We know that from the American Lung Association, but that's going to add up over time fairly quickly, considering you're taking anywhere from 20,000 breaths a day, something along those lines, I believe. So if we look at this picture on the right, this is essentially you cut in half. And we got our diaphragm up here, we got our pelvic floor in the bottom, and then we got our muscles of the anterior core here, and posterior would be your spinal erectors, lats, multifidus, things along those lines. So we got to remember the diaphragm is just like every other muscle in the body. It works synergistically with other muscles, and that would be your pelvic floor here. So if you imagine the pelvic floor and the diaphragm working together, this almost looks like a big canister, right? Big pressurized canister. So one of the things that you got to remember with the diaphragm, and especially with the pelvis and the rib cage, is that position affects activation. Meaning that all joints in your body, based upon their positioning, that will determine activation of specific muscles. So here's a fun little test that you can do on yourself. Stand up right now. Yep, stand up in your chair. Arch your back as hard as you can, provided there's no pain. Just arch your back. And try to brace your abs or squeeze your glutes. Either or try them both. It's probably going to be very difficult to do either one, because why? Well, what you've done is you've actively anteriorly tilted your pelvis forward, and you placed your glutes and abs in a position of insufficiency, where it's very, very tough to get activation and proper co-contraction of specific muscles. Now, while you're still standing, think about pulling your zipper up towards your face. So what you're doing here is you're posteriorly tilting your pelvis and getting your abs and your glutes in a better position to fire. Now, try and squeeze your glutes, take a breath, and try and brace your abs like somebody's about to punch you in the stomach. It's probably a whole lot easier, right? Yeah, position affects activation. That's one of the most important things you'll have to remember, or you should remember, with every single joint within the body. Here's a simple analogy. Inner abdominal pressure is like a can of Coke. All right, so you got your can of Coke. He's highly pressurized on all sides. So remember our other model. We got our diaphragm up top, our pelvic floor below, abs in front, spinal erectors, lats, everything else in the back. Now what happens if you take a knife or a sharp implement and you stab it in the side of the can of Coke? All the Coke shoots out the side, right? Yeah. And now we've essentially lost our pressure. Well, the same can be thought about for your core and for your pelvis and your rib cage. As soon as you arch your back and your pelvis tilts forward, your rib cage then starts to tilt up. What's happened? Well, boom, we've essentially just punctured the side of our Coke can, our pressurized cylinder. That's why pelvis and rib cage position is so dramatically important. Now, as we move on, if you've ever taken choir or voice lessons, you know that diaphragmatic breathing is often incorporated because within singing it's incredibly important. But within lifting weights, it's also very, very important as well, due to how much inner abdominal pressure influences spinal stability. Now, we know that athletes and those who train with poor motor programming are very, very heavily extended. Now, with extension, what's going to happen? You're going to get that arch within the low back. You're going to get very, very taut or tight spinal erectors. The pelvis is going to tilt forward, and the rib cage is going to tilt up. What's going to happen? You're going to lose congruency between that pelvic floor and diaphragm. We've essentially just ruptured our Coke can out the side, and now it's very tough to generate that inner abdominal pressure. Not to mention, if we think breathing now, how are they actually going to pull air in? Well, rather than being able to use their diaphragm to actively inflate their lungs, they have to rely more upon accessory musculature to breathe. So this will be your scalenes, pec minor, levator scap, subclavius, all things of that nature, where they're actively firing all of this musculature to pull in air to their lungs. But building upon that last point, we have to remember that our aerobic system primarily determines our recovery capabilities, both day to day, set to set, and rep to rep. So your lactic system, or your anaerobic metabolism, is fairly self-limiting in nature due to the accumulation of hydrogen ions and lactate generating intercellular acidosis. But aerobic improvements basically can include increased mitochondrial density, which increases ATP production. So if we think back to phosphagen systems and what we would typically use within lifting, you get a quicker recharge if you have faster ATP production of other energy systems. Not to mention, during rest, our aerobic system provides the substrates necessary to get more phosphocreatine into the muscle to improve phosphagen metabolism. So, if for some reason our aerobic system is inefficient or not functioning at its highest capabilities, that's going to definitely influence our recovery from our previous lifting sessions day to day, as well as individual sets within that lifting session and with individual reps within each set within that lifting session. So, going back to breathing, we have to remember that everything begins and ends with the breath. Before you unrack the bar, you take a breath and then you walk it out, right? You finish the rep, you exhale. Everything begins and ends with a breath, but pelvic position determines that breath. If we have good pelvic position, we'll get good muscular activation, we'll have efficient breathing mechanics, and we'll have good peripheral recovery capabilities. So if we think back to our Coke can analogy, and we think then to aerobic systems. Now, if we have a poor pelvic position, if our pelvis is tilted forward, and our rib cage is popped up, and we go to taking a breath, we're not going to get full expansion of the lungs. Just like we talked about, we're going to have to use that accessory musculature to breathe in. Now, when we do so and we can't breathe in completely, we're going to be lacking in oxygen delivery to our muscles. Therefore, we're going to have very, very poor recovery capabilities. But if we can improve pelvic position and rib cage position, we're actually going to improve oxygen dissociation from hemoglobin and delivery to our muscles. So we're actually enhancing efficiency of the aerobic system without actually training it. We're just improving biomechanical positions. So it's pretty cool the influence that breathing has, not only on our recovery, but also on specific activation of certain muscles. Now, you've assessed your client. You're starting to write your program. You always start with a warm-up, right? You kind of know what you got to work on here based upon your initial assessment, but how do we progress the warm-up, and what do we really start with? Well, you always want to start with your largest basis support, and basis support is determined by number of contact points with the floor, essentially. So if you're standing, you have 2 contact points, and that's going to make you more unstable than if you were quadruped on your hands and knees, where you would essentially have 6 contact points, hands, knees, and toes. From this point, you would then progress to positions of higher instability. You want to involve more joints. You're going to have a greater input than from gravity if you take yourself to standing or to maybe half kneeling or tall kneeling. And then you include larger ranges of motion. Also include within the warm-up, make soft tissue work a priority. We'll touch on this a bit further within the presentation, but it's very important to incorporate both the use of lacrosse balls and foam rollers to help enhance the central nervous system and make sure that certain tonic muscles and phasic muscles are both inactivated and shut off. Activated and shut off. So a proper progressive warm-up has both mobilization and activation pieces. You're going to isolate certain joints with mobilizations and then go on to activate those specific joints after the mobilization. So for example, with the shoulders, we might foam roll the upper back, work on a little bit of thoracic extension on the foam roller, then go into a quadruped T-spine rotation, and then a forearm wall slide. Again, going from mobilization into activation of that specific joint. Now, one other piece of the puzzle is looking at progressions from points of contact. Initially, you want to start from the ground up. So the most stable position you can put somebody in is prone. Lay them on their stomach. If somebody is breathing into their upper chest and they're using all of that accessory musculature, as we discussed above, then maybe You want to put them prone on your stomach and say, all right, now you have kinesthetic feedback from your stomach breathing into the floor. You can feel it when it pushes out against the floor. That's when you're breathing diaphragmatically. You're not using your upper chest musculature. Or maybe you put them supine. Maybe you put them on their back in a 90-90 position up against the wall with their feet elevated. Again, one of the most stable positions someone can be in with the least influence from gravity. From here, move them into a quadruped position. Take them onto their hands and knees. Start them doing bird dogs or start them doing bear crawls. Something where we can give them a little bit more stability and take out some of the joints. Progress to half kneeling, then at that point, one knee down. It's much tougher to extend through the spine here as we have one hip inflection and one hip extension. Go tall kneeling next. Both knees down. Finally progress into a split squat stance where the back knee is hovering in that half kneeling position, getting a little bit more activation of the hip musculature. Now into bilateral, so more influence from gravity, and finally into dynamic locomotion where we're starting to incorporate multiple joints, larger ranges of motion. So here's an example that I would use in this picture on the right with most of my athletes. This is a quad hip flexor mobilization. Takes out a few of the lower body joints, the ankles and the knees, but it also allows you to be very, very stable and get a good stretch through the quad. You see many people doing this in a gym standing where they're pulling their heel to their butt, but what you have to remember, or keep in mind at least, is a lot of times you'll see that knee shoot out to the side, and what they're doing is they're compensating for a very, very tight quad. And you may also see people as they're pulling that heel to their butt, what happens is they begin to arch their back and that pelvis tilts forward because of that tightness in the quad is actually pulling down on the front of the pelvis. So they're compensating essentially through that exercise, when if they broke it down to a more stable position, they would be able to get the stretch through the joint that they want. Now, going back to some soft tissue considerations. What are you actually doing with foam rolling? Everybody's rolling around on lacrosse balls, foam rollers. I've even seen car buffers get popular here now with some soft tissue work. Well, within foam rolling or self-myofascial release, what you're doing is you're essentially influencing proprioceptors within the skin that govern tension within your body's fascial network. And fascia can be thought of in the most simplistic sense as shrink wrap around your muscles. So what these proprioceptors do is in certain patterns that are overused or in certain positions that your body grows accustomed to, then that fascia will become taut and stretched based upon a muscle's pull upon it. So when we foam roll or we use a lacrosse ball in certain positions, what we're doing is these proprioceptors respond to pressure. So when we place a specific amount of pressure upon them or put them in certain positions where they're overloaded with pressure, then they essentially shut off, and they shut off the tension to that fascia and to that muscle. So, what are some common trouble spots? Well, you see it in a lot of folks. Ankles, hips, and thoracic spine. Most people sit a lot during the day. I'm sitting right now giving this presentation. Well, when you sit, your ankles are probably lacking dorsiflexion. You either have your toes pointed or you're in shoes perhaps that have a bit of a heel on them, whether it be high heels, dress shoes, anything of that nature. Well, anytime we're shifting weight forward and changing our center of gravity, our body's going to adapt biomechanically. So what's going to happen is when you shift that weight forward, the posterior aspect of your body is going to start to tighten down so that you don't lose your balance. Your body's going to adapt. Well, the same thing can be said for the hips. Sitting, you're essentially in a position of hip flexion all day. Well, over time, those hip flexors may actually begin to get tighter. Now, this isn't always the case. There's research that potentially says otherwise, but essentially sitting is going to cause some biomechanical adaptations at specific joints. And the last one, your thoracic spine. This is your upper back. We're writing, we're doing a lot of typing, we're doing a lot of reading, texting. All of these things put us in a more kyphotic or hunched over position. That's something that we need to get out of and that we need to work through with our soft tissue considerations. And finally, something that used to be touted for soft tissue work is that you're breaking up scar tissue and that you're removing adhesions and this and that within the specific muscle groups. And that's really not the case. What you're doing with soft tissue work is you're essentially resetting your central nervous system and the tone to specific muscle groups before you train or after you train. So in essence, you're not actively changing the length of the muscle, you're changing the input to the muscle, which then may reset it to its original length. So it hasn't become chronically shortened. You haven't lost actual length in the number of sarcomeres within the muscle. They may actually just be contracted. So foam rolling works to release that contraction and help generate more of a relaxed tone within that specific muscle group. Okay, so this was a segment that I did within this guest lecture at USC, and now that we've talked some of the basics of periodization, it's fun to see what people know sometimes. So initially I'll throw up a picture of this gentleman deadlifting, and take a look at the picture, pause the video if you want, but look at his posture biomechanically, and let's see if we can determine, is that a good lockout position for a deadlift? Is it a bad lockout position for a deadlift? And kind of see some of the answers that you can come up with on your own before you continue on watching this video. Alright, so if you've taken a few seconds or a few minutes to pause the video and look at the picture, I'm sure some of you might have said, wow, that looks like a pretty solid deadlift. You know, I wouldn't mind that lockout position. Well, there's a few things that are going on here. They're very, very subtle, but once I point them out, it'll be easier for you to see within your own training as well as when you watch other people train. Now, the first thing that we notice is he has a very, very flat thoracic spine here. Now, we know the thoracic spine should have about 30 to 40 degrees of flexion naturally. If we think back to our initial conversation on breathing, well, if you have a very, very flat thoracic spine, that's going to determine your amount of apical expansion, or the amount of air that you can draw into your lungs. So if we're very, very flat back through here, what's it going to do? It's going to force us to draw more air into the front of our chest and not be able to inflate this backside of our lungs. So again, that becomes a problem. The rib cage starts to pop up and we lose that pelvic position, just like we talked about earlier. He's got excessively retracted scaps, so he's pretty pulled back in his scaps. Now, you see a lot of guys coach this: pull your shoulder blades back before you deadlift. Now, think about this for a second. Reach your hands out in front of your body while you're sitting in your chair. Now, think about trying to protract or move your scaps around your rib cage and reach for something in front of you. Now, do the opposite. Pull your shoulder blades together and try and retract them and pinch your shoulder blades. Did you see what your hands did? Well, when you protracted them forward, it actually moved your hands further away from your body. However, when you retracted them, it brought your hands closer to your body. Pretty simple biomechanics. But if we think about the deadlift, when we're reaching down for the bar, why would we want to move our hands closer to our body? Because now then essentially we would have to drop our hips lower, and it increases the range of motion of the lift, making you more biomechanically inefficient. So I'm not sure why you would ever coach a retracted shoulder blade position on a deadlift. You're just making the lift harder for your lifter. We also see he's very, very extended through his lumbar spine. Again, that pelvic and rib cage position comes back into play. If you, just like we did earlier, if you arch your back, it's going to be very, very hard to finish with the glutes and complete the deadlift and maintain a neutral spine with a good braced position of our anterior core. Just like I mentioned, lack of gluteal engagement. He's not bringing his hips into the bar. He's not finishing with his glutes. And finally, poor anterior core stability. We can see here the bottom of his rib cage is popped up. He's got that big rib flare, tilted pelvis. The two combined, it's not a good thing. So now, what does a good finish position look like? Boom. Right here, we got more thoracic flexion. Looks a lot more natural. Rib cage is down. No longer excessively lordotic in that lumbar spine. Guys are going to have anywhere from about a 3 to 5 degrees of extension within their lumbar spine. Women are going to have a bit more, about 5 to 7 degrees. That's just normal anatomy. That's how things should be. But it can get to the point where it's a bit excessive, and that's when it becomes an issue. Again, we see the glutes here are engaged, finishing with the hips into the bar, and some solid anterior core engagement. So one more. The overhead squat is something that you can use as a very, very easy biomechanical test. It's going to convey a lot of information to you as a strength and conditioning coach regarding mobility, stability, motor patterns, as well as compensation patterns. So with our lady here, she's got an okay overhead squat. There's definitely a few things going on with it. So again, with the last one, if you want to pause the video for a few seconds, kind of think about biomechanically, what's a good squat, what should it look like, and kind of think to yourself that. Go ahead, then we'll kind of talk through a few things. All right, so what's going on with our friend here? Well, first of all, we got to remember that the torso and the tibia angle differ. So right here, our two red lines, those should be parallel, almost like railroad tracks. A good squat resembles a lightning bolt. So we got our torso coming down here. The rest of our lightning bolt would be then through her femur and her tibia. So if those lines are intersecting, then we got a little bit of an issue there in terms of maybe hip mobility or ankle dorsiflexion. So maybe she's got some instability in her anterior core. Maybe that prevents her from staying upright, and maybe that's one of her main issues in the difference in her torso and her tibia angles. She's definitely got some poor ankle mobility. You probably need about 20 degrees of dorsiflexion if you're going to squat, deep squat properly. So the fact that she has very, very little dorsiflexion within her ankles here is a pretty good indicator that that's a limiting factor for her. She also lacks some thoracic extension, which might be another reason why she can't get her arms overhead. And those lines are also crossing over one another. Inadequate depth. Nobody likes quarter squatters. So that's an issue there as well, getting that femur to parallel. She might also have some tightness through her anterior chain. So through her iliopsoas and rectus femoris, both of those cross the hip joint. So when she then tries to enter into a squatting position where she needs hip flexion, what she might find is if she has tightness through her psoas and through her iliacus, also known as the iliopsoas, and through her rectus femoris, those may actually be contracting at the hip and they pull her torso forward because they cross the hip joint. So what does a good one look like then? Well, that's a pretty solid overhead squat. Again, she's not really to depth, but you'll notice that she has much more dorsiflexion in the ankle. She's got more thoracic spine extension here. She generates a lot more stability through the hip complex. And you also see that when I send in this last line, she's got that nice lightning bolt complex throughout her torso, showing a very, very good squat. So now we'll go kind of joint by joint and discuss some of the influences regarding specific joints and how to train them. So what's your purpose of your core? Well, if we think about sprinters, what's happening during a sprint? Well, you're getting force transfer essentially from your lower body up through the ground, through the lower leg, and then into the upper body, which then propels you forward. So one of the main purposes is, of course, force transfer. If we think back to our sprinter example, we can look at films of Usain Bolt and other sprinters, and what's the first thing that you notice? Well, for me, what I notice is their cheeks are bouncing, meaning that they're very relaxed through the face, but yet their torso from below their neck to kind of the top of their pelvis stays locked in. So that core is engaged actively, but they're able to move their extremities, their arms and legs, very, very fluidly, despite the fact that that is very, very solid. So it's also very important for lumbar stability, in that if we improve anterior core stability, then that may also improve lumbar stability and reduce symptoms of lower back pain. Also, it's important for pelvic stability. So when you're going to change direction with the lower body, we have to think that if we have a more stable core and we're able to transfer forces more efficiently through the upper and lower body, then that's going to improve the speed at which we can change directions. Now, the way we train it, it's debated highly among coaches, but what I like to use with a lot of my athletes is four specific movements: anti-extension, anti-flexion, anti-rotation, and anti-lateral flexion. Now, I'm not entirely against movement, as I'll cover more in the next slide. I think that your core is designed to move, and there are certain exercises which can be incorporated to generate that movement. At the same time, I don't program in many sit-ups or curl-up variations for that matter. Um, Other people may have a different opinion on that, and that's fine. If in the future research says otherwise and shows they're beneficial for specific reasons, I'm open to changing my mind about that. But at the moment, this is what I've found to be very, very beneficial for a lot of my athletes for improving sport-specific abilities as well as for hypertrophy as well. So I'll go through a little bit of examples for each one of these. So with anti-extension, you're going to have anything from planks to ab wheel rollouts, push-up variations, overhead presses, farmer walks, overhead carries, all things of this nature where you're having to resist arching the back and going into extension. Now, anti-flexion. This one kind of throws people for a loop sometimes because you got to think, well, if I'm trying to resist flexion, what is actually causing that within training? Well, you're already doing it probably, at least you should be. All squat, deadlift variations, good mornings, things of that nature, they're all trying to pull you into flexion, whether it be flexion of the lumbar spine or flexion of the thoracic spine. Their main influence is on that flexion component. So that's how you would train anti-flexion. Now with anti-rotation, you would have anything from Palloff presses, landmines, single arm dumbbell presses, chops and lifts. All of these can be incorporated, and they're very, very beneficial, especially with golfers and baseball players or specific sports where the athlete is just living in rotation. They don't need more rotation within their core training. So you wouldn't have them doing Russian med ball twists on the ground. At least I hope you wouldn't, because these guys are just rotating through all day long, hopefully through their hips. If they're rotating through their lumbar spine and you're having them do more rotational work within their core work, then you're definitely leading into a spine pathology very, very quickly and shortening that athlete's career. And the last one, anti-lateral flexion. So these would be your side planks, your one-arm farmer's carries, anything of that nature where you're having to resist flexion to the side. But if we're on a time constraint and we have, especially in collegiate athletics, classes and tutoring sessions and other things of that nature that we're having to battle for time, then we can combine multiple aspects in one. So, for an example, we might have a side plank with a row. Here we're getting anti-lateral flexion with our side plank. We're also getting anti-rotation though. During the eccentric or lowering portion of the row, we're having to resist rotation from that cable, but we're also getting anti-extension. During the concentric or pulling portion of the row, you're activating the lats. And the lats attach on the lower portion of your back at the thoracolumbar fascia near your lumbar spine. So when these are activated, what they can do is they can pull you into scapular depression, but they can also arch the back. So by doing that row during the side plank, you're having them to resist that extension from the lats. But above all else, when you're training the core, don't just be like this guy. I hope you're not just hitting 1,000 crunch variations a day and wondering why your low back still hurts, because I can give you the answer right now. Like I said, I'm not totally against sit-ups, but just make sure that there's a specific reasoning for why you're doing them. They don't cause pain and other things of that nature. So as I said, I'm not totally anti-movement. I know that's kind of the functional guru thing, train anti-everything. But the truth is your spine and your core musculature is designed to move. Golfers, swimmers, gymnasts, baseball players, all of them are getting rotation, flexion, extension through the spine during their sport. And I'm pretty sure there's no issues within any of those sports, and people are playing those sports throughout their lifetime. Not to mention, you got to bend over to tie your shoes. You're getting spinal flexion then. So unless you plan on having somebody else tie your shoes for the rest of your life, I'm pretty sure your core is designed to move. But we know that, based upon Stu McGill's work, the mechanism of disc herniation or prolapses is repeated lumbar flexion, especially at end range, combined with very, very modest concomitant compressive loads. So essentially, what that's saying is anytime you have lumbar flexion with a load compressing down on the spine, so think axial loading, squats, deadlifts, that's why you have a very, very high rate of disc herniations. Anytime you're getting lumbar flexion with those two elements together, that's what's going to cause a disc herniation or a prolapse. So that's why I'm not the biggest fan of sit-ups, just in that you're going to end range flexion with every single repetition. Now, some may argue, well, it's not loaded. Well, sure. But in the long run, are you training specifically for hypertrophy or for longevity? If you're training for hypertrophy, then I might say, well, then a sit-up may not be the worst possible thing that you could do. But if you're training for longevity and maybe you have back pain, then I would say sit-ups probably aren't what needs to happen right now. Not to mention, there was a recent study by McGill and colleagues showing that isometric core training is actually more beneficial at enhancing core stiffness than dynamic training. So very, very interesting. That study just came out this year showing a bit of an increase. So just something to keep in mind. Experiment with both. If you find that you're always doing sit-ups and it's bothering your low back, then it's time to reconsider some of those other elements that I outlined earlier: anti-extension, anti-rotation, and anti-lateral flexion, and start incorporating some of those. I actually wrote an article on muscle and strength regarding some of those core elements. So if you're interested in that, you can Google that. Google my name plus muscle and strength, and it'll pop up, and you can have a read there. The number one thing we always want to keep in mind, though, when we have high compressive forces or axial loading, maintaining spinal neutrality is the most important thing. Just like we talked about pelvis and rib cage position earlier. Position affects activation. If we keep the spine neutral, we're going to improve activation because we have a better biomechanical position. Always keep that in mind, whether you're training yourself, training others, writing programs, thinking about program design. That's the most important component. Now, if we're thinking hamstrings, hamstrings are a biarticular muscle group, meaning that they're crossing two joints. They cross both the hip and they cross both the knee. That, in essence, is going to lead to hip extension coupled with knee flexion. So, now that we know the basics from an anatomy standpoint, then the question is, how do we train them? So, the short head of the biceps, if we look over here laterally, we see that it doesn't cross the hip joint. So, we know that basically if it assists in knee flexion, that it's very, very beneficial to program in knee dominant movements, such as your leg curls, whether that be supine or prone. We also know that during sprinting, our long head of the biceps femoris, our medial hamstring on the inside, increases 12% in length compared to what we're seeing in upright posture. And we also know that during the terminal swing phase, when you're sprinting, the hamstrings have to produce peak force and they go through a lot of eccentric loading to absorb energy during ground contact. So what this means is that essentially during the terminal swing phase, that's right when you're coming out of knee flexion and going back into hip extension when you're getting that ground contact. So when we get that change in length, 12% is a fairly big change. So that's when you're going to see a lot of hamstring strains, hamstring pulls. So that's definitely going to influence training of the hamstrings. Therefore, due to the last 2 points, we know that in order to optimize injury prevention and rehabilitation, you should train the hamstrings in positions that involve long muscular tendon lengths and high eccentric loads. So we'll go through a few examples that include both the biarticular fact of the hamstrings, along with this last point to give you some ideas for your program design. Now, going back to the biarticular point, we know that since the hamstrings cross two joints, that if we're going to optimize development of them, that we should be training them in positions of hip extension and hip flexion, coupled with knee extension and knee flexion. So some quick examples. An RDL and a glute ham raise, or Romanian deadlift if you're not familiar with that. An RDL essentially trains hip extension with knee extension, whereas the glute ham raise is training knee flexion with hip extension. The two are in opposition, but in order to work a biarticular muscle, that would be an excellent example. A lying leg curl. So here we're getting, and this would be a prone lying leg curl, not supine. Here we're having hip extension coupled with knee flexion, and then hip thrusts. There we have knee flexion coupled with hip extension. Again, opposites, going back to our biarticular muscle group. Good morning. That's hip extension with knee extension, and then a Nordic hamstring curl. This would be knee flexion with constant hip extension. Very, very similar to our RDL and glute ham raise. Hyperextensions, glute emphasis here. So keeping the spinal erectors very, very quiet, just moving through the hips, not the spine at all. So they were training hip extension with knee extension, and then seated leg curls. Here we have hip flexion with knee flexion. So one in opposition to the other. Just some practical examples there. Make sure that you're thinking about hamstring training in a complete sense from both a biarticular muscle standpoint, but also use lots of eccentric loading based upon the fact that that occurs quite significantly in sprinting. Now, moving on to the quads. When you're training, you got to follow a logical progression in training the quads, just like you would in your warm-up or in any other muscle group. So we got to start with the most stable position possible, same as in our warm-up. Our most stable position for the quads is a half kneeling position. Here, just like I mentioned earlier, one hip is in flexion, one hip is in extension, so it's much tougher to move through the lumbar spine. Now, what do you do if you want to increase the difficulty of an exercise without actually changing the exercise? Well, in terms of changing the exercise entirely. So if you have a split squat and you want to progress that split squat, but you don't want to move to a walking lunge, how do we make that exercise more difficult? Well, the next thing we can do is we can decrease our points of stability. So in a squat, you have a bilateral base of support in that you have 2 points of stability here. Whereas in a split squat, you still have 2 points of support, but they're split, and now they're much wider, and you're on a very, very narrow plane there. Same as if you took a bench press. You have about 4 points of support in a bench press. Whereas if you move that to a stability ball and you do a dumbbell bench press, you decrease your points of support to 3 there. Now we can narrow our base of support. This is basically stance width. If we start with a split squat and we start with our feet wide, like they're on railroad tracks, and then we essentially move our front foot and our back foot closer and closer and closer, like on a tightrope, now we're narrowing our base of support. Think like a sumo wrestler. Why is a sumo wrestler so hard to knock over? Well, they have a very wide base of support, whereas if you're just standing with your feet close together, that's a very narrow base of support. You're much easier to knock over. Or we can raise the center of mass. Raising the center of mass would be if you had dumbbells at your side for doing a dumbbell split squat. Now, you put a bar on your back. You've now essentially raised your center of mass. You're still doing a split squat, but it's a tougher exercise. From there, we might take the bar overhead, and that can make the exercise even tougher. Let's increase the range of motion. So take our split squat, then we elevate the front foot. Now we've essentially made the exercise tougher without actually changing the exercise entirely. Maybe we'll increase dynamic movement. So we'll take the split squat and now we'll turn into a reverse lunge. So now instead of keeping that back foot stable, it'll step forward and back, and we increase the dynamic movement. Increase eccentric loading. Take that reverse lunge, turn it into a forward lunge now. So we have to decelerate, moving forward, and then step back. More eccentric loading than the reverse lunge. Increase the time under tension, or TUT. This would be tempo work. You'd have longer eccentrics. That's going to improve muscular damage, as we mentioned before in the mechanisms of hypertrophy. And then using asymmetric loads. This would be your one-arm dumbbell bench, your one-arm dumbbell split squats. And then thinking back to our core training, this is also going to get some anti-lateral flexion as well. So, real simple progression series here. You got your split squat. Make it a little tougher. Elevate the front foot. Now, we're going to move on, go to our step up. From there, we would go reverse lunge. Elevate the front foot here. Increase the range of motion. A little bit more eccentric loading. From here, we'd go Bulgarian, or rear foot elevated split squat. Improvement in the range of motion, but again, less dynamic movement here. So change one variable, make it easier in one instance, but a little bit tougher in others. Counterbalance single leg squat to bench. This would be holding a plate out in front of you, or holding a dumbbell in a goblet format, squatting to a bench, almost like a pistol squat. From there, we'd move on to a lateral lunge, a bit more eccentric loading, more of a decelerative component. A forward lunge, finally, and then the pistol squat. And the reason why I included this progression is I see a lot of folks starting with a forward lunge and then wondering why they're getting knee pain and knee issues. Well, there's a progression within single leg training, and so evidence by that knee pain, it's obvious that biomechanically we don't need to be in that position yet. We don't have the stability and the mobility for it. So if you have issues with knee pain, or if you're writing programs, always remember this kind of flow chart or this progression series and look back at the other slides to determine how to go about training the quads and setting that up within your programming. Now, glutes. So if you want to learn about glutes, Bret Contreras is your guy to go to. He's going to have all the research. He's the glute guy. So Google him if you're interested in more research on the glutes and training them and research as well. Now, we know that they're responsible for stabilization of your SI joint. Your SI joint is right at the intersection of your spine as well as your pelvic bones. This is where people get a lot of issues, especially when training. So the glutes also function as a triplanar muscle group, meaning that they function in the sagittal plane, forward to back, the frontal plane, left and right, and the transverse plane, which is essentially the rotational plane within your body. So we know that all fibers in the glutes are involved in hip extension, hyperextension, external rotation, but only the upper fibers are involved in hip abduction and single leg support. And this will come into play later when we're discussing exercise selection, but for right now, it's just important to keep in mind that all three planes are incorporated within the glutes. So in regards to sprinting, we also know that hip extensor strength, aka strength from your glutes, appears to be more important than knee or ankle strength. And that the moment arm of the glutes increases as the hip extends from flexion into extension. So with higher moment arms, we get a greater mechanical disadvantage, thus decreasing the efficiency of the glutes. So it's vitally important that we train the glutes in a disadvantageous position of full extension in order to increase the propulsive rate of force development from increased cross-sectional area. So if you're not tracking, what I mean is thinking back to our hamstring example, including things like hip thrusts, including things like RDLs, things where you're training the hips going from flexion into extension, because we know that that moment arm is longer and they're at a greater mechanical disadvantage, so we need to train that position in order to enhance that mechanically inefficient position. So again, the glute guy, he shows up one more time. Thinking back to our triplanar discussion of the glutes, we got to remember that we got to include vertical and horizontal loading variations. So vertical would be squatting and deadlifting. Horizontal would be more things like hip thrusts here in our bottom right corner. All three planes, like we talked about, you got to maximize performance benefits and injury prevention. So including simple things in your warm-up like low-level activation drills, clamshell here with a band. That's going to get more frontal plane activation as well as some transverse plane from internal and external rotators, and including those within your warm-up after your mobilization pieces as part of your activation series to enhance pelvic position, and thus that's going to improve breathing mechanics like we talked about. Position affects activation. It's all starting to tie together here. Now, if we think shoulders, scapular congruency on your rib cage, so how well your shoulder blade sits on your rib cage, is determined by apical expansion, aka breathing, and thoracic curvature. Just like our gentleman that was deadlifting earlier with a flat thoracic spine, that position is going to determine activation of many of the scapular muscles on your shoulder blade. So if we have a very, very flat thoracic spine that's basically supposed to be rounded, and then you're trying to fit a rounded shoulder blade onto that flat thoracic spine, you're going to have very, very poor congruency. It's kind of like trying to pound a square peg into a round hole. You can't do it. So thinking back on our breathing discussion, that's another reason why breathing is so vitally important, because it influences scapular position, it influences rib cage position, pelvis position. All of these things come into play, especially when we're talking strength training. As I mentioned before, a lot of strength athletes are very, very extended, so they got a flat thoracic spine. Anterior pelvic tilt, which means their hips are tilted forward. They have a depressed shoulder girdle. So our lats attach at our humerus, and if they're very, very tight, they can pull us into extension and pull down on our shoulder girdle. So tight lats, tight pecs. We don't have any glute activation. Think back to our example where we arched our back, tried to squeeze our glutes. The two work in opposition here. So all of those combined means that we're going to be quote unquote missing overhead range of motion. You're going to find with some of these athletes when they go to reach overhead, they're going to arch through their lumbar spine. And as such, they're not going to notice it, but you're going to have to pick up on it and say, all right, now I want you to exhale a little bit, brace your abs, and then try and reach overhead. And what you're going to find is a lot of times when they're reaching overhead, then their hands are going to then come forward and they're going to be quote unquote missing complete overhead range of motion. So then the question is, how do we help to restore that? Well, if we think about our upper traps in this picture on the left here, if our shoulder blade is pulled down, 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 that puts the traps in a mechanically inefficient position to contract, right? Because they're fully stretched. So if we think about length-tension relationships, there's going to be less chance for cross bridges to form, less contraction then, and less strength. So in that sense, when we have the shoulder girdle that's pulled down, an overly stretched upper trapezius, then when we go to get overhead and we need this force couple on our left to get good upward rotation, we're going to have a whole lot of trouble in getting that overhead range of motion. So we think, all right, well, we need to restore some strength to that upper trapezius. All right, well, let's do dumbbell shrugs. Well, the only issue with dumbbell shrugs is that you're not actively getting upward rotation here. You're only getting scapular elevation. So can they play a role in helping to restore that range of motion? Slightly, sometimes, yes. But what you might find even more beneficial is an overhead barbell shrug. In that with these, you're going to get more serratus anterior recruitment as well as lower trap recruitment because you're in a position of full overhead shoulder flexion and you're having to recruit that upper trapezius to elevate and upwardly rotate that shoulder girdle. So just something to keep in mind, especially with highly overly extended athletes in terms of restoring that shoulder overhead range of motion. One more time, just like in training the quads in our warm-up, you got to follow a progression series. You got to earn the right to overhead press. So if you see somebody who's military pressing, as soon as the bar comes off their shoulders, they start to arch their back. Well, they haven't essentially earned the right to overhead press. They need to progress through this series and learn to stabilize different joints in different positions. And remember that they have to get movement at their scapula independent of movement from their spine. So this is just an example of a progression series. It's not the only progression series, but it's something that I've used with many of my athletes. It's very, very beneficial to find out where a person is kind of on the progression series and then work from there in their programming. Behind the neck press, I had a few people ask me about this during the lecture, why I included it. It's not a bad movement. It's just been demonized because many folks have shoulder mobility issues, and thus when they go to perform the movement, they get pain. So they've associated correlation with causation, and the fact is that's not always the case. So with the behind the neck press, actually I don't think I have any athletes that are doing this movement, but it's beneficial to include in terms of the progression series, as you may be a higher level athlete yourself, or you may be working with higher level athletes where it might be beneficial to include it. Finally, it's important to remember that adaptation occurs in 3 planes. So just like the glutes, the scaps can move elevation, depression. They can also retract and protract, and then they can anteriorly and posteriorly tilt. So if we think about scapular depression, what is causing that? Well, that would be things like deadlifts, lunges where you're holding dumbbells at your side, farmer's carries. All of these things are pulling the shoulder girdle down, 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 down. With an extended athlete, that's already probably fairly depressed. And you may find this to be the case in baseball players and other overhead athletes. So we don't necessarily want to generate a huge amount of scapular depression within their training, which is another reason why it's important to balance that with upward rotations, such as those overhead barbell shrugs that I mentioned earlier. Moving on, one more point about the shoulders. As I mentioned, most overhead athletes aren't going to be able to train overhead in a standing position. It's not a problem, but it's just important to remember because lats and pecs often compensate if that rotator cuff shuts off. So if we don't have strength in that rotator cuff or endurance for longer events, or if we don't even have any sort of activation, both of them are going to turn on. Both of them are internal rotators then, and as such, they're going to close down that subacromial space, and you're going to have a higher chance for shoulder pathology when you have excessive internal rotation, coupled with anterior scapular tilt. That being the case, you're going to have very, very limited overhead range of motion due to depression of the shoulder girdle, since that lat and pec are both pulling down on it. So how do we train the shoulders then? Well, prioritize half-kneeling variations initially and include anti-extension core work. What you're doing with the half-kneeling variations is you're teaching the athlete how to differentiate movement at their glenohumeral joint, specifically their shoulder joint, from movement at the spine. As I mentioned earlier, many people, as soon as they go to press, automatically overextend at the spine. So that's why it's beneficial to include an anti-extension variation in their core work so that they're understanding neurologically that motor pattern should be differentiated one from the other. And last but not least, second to last, we have the pecs here. So it's very important to include push-up variations within your bench work because we have to remember that you're also going to get comparable strength gains from your push-ups when looking at them versus bench, as evidenced by a very recent study in 2015 out of the Journal of Strength and Conditioning Research. So they're not completely worthless. Not to mention, they're also very, very important for serratus anterior health. Now, as we saw in that picture earlier when training the shoulders, the serratus anterior is kind of that muscle on the side of your rib cage. It kind of looks like fingers that comes around. And that's mainly responsible for protraction and upward rotation of the scapula. So in a lot of our bench variations, the shoulder blades are typically coached to be down and back, tucked into your back pockets. And that's a really solid position biomechanically. But if our athlete is already highly extended and that shoulder girdle is already cranked down and depressed, then that's not going to be a very good cue for them. Not to mention, you're not going to get any sort of movement in your shoulder blades. And that's how they were designed. They were designed to move around the rib cage. So that's why the push-ups are the best of both worlds. They allow your shoulder blades to naturally move around your rib cage and give you more thoracic flexion during the concentric portion of the movement. And not only that, they teach someone proper kinetic chain mechanics. So as I mentioned earlier, a push-up is just essentially a moving plank. It's an anti-extension variation. So it's closed-chained, and if someone understands proper rib cage position, proper pelvic position, and can maintain that, then the push-up becomes a very, very good teaching tool to help them understand force transfer throughout the entire body and how one kinetic chain or one joint within the kinetic chain can influence others. But above all, don't be like this girl with your push-ups. That's my cue for the day. Lots of push-ups like this in many commercial gyms that I go into. So get your ribcage position right, get your pelvic position right, learn how to breathe and brace, and that's going to clean up a lot of these faulty mechanics. And last but not least, training the back. So when writing programs, it's important to remember that if we have a pushing volume, then we need to be doing double as much for our pulling. And in those with shoulder issues, we probably need to be doing triple as much. So a simple way to look at this, if we're doing 3 sets of 6 on bench, that's 18 total reps. So we need to be doing at least 3 sets of 12 or 6 sets of 6 on our pulling volume there, double as much. Just simple things to keep in mind when you're writing your own programs or writing others' programs. In those that are already overhead throwing athletes or very, very extended, you probably need to decrease vertical pulling. As I mentioned earlier, your lats attach to your thoracolumbar fascia. So if we're doing a lot of vertical pulling, they can actually enhance that extension bias and pull us into that more lordotic position. Now, when we're doing horizontal rows, we got to remember that the scap should be moving only in the frontal plane, so protraction and retraction. Don't allow it to aggressively depress or elevate during this movement. As such, what you're going to be doing is compensating with either the lats or compensating with the traps if you have poor strength in the muscles of your upper back. So during the row, it's essentially two movements combined. It's retraction of the shoulder blade coupled with glenohumeral extension. And that's going to bring me to my last point, in that you got to pay attention to the head of your humerus and ensure that you maintain neutrality with the ball and socket joint. So an easy way to do this is doing a standing cable row. Have your client or have yourself place your free hand upon your shoulder that is doing the rowing. Monitor ball and socket position there. And so with the row, one of the easiest ways to think about it is think pinch, so scapular retraction, and then pull, glenohumeral extension. Just be aware of that ball and socket position and have your hand on the front of the shoulder, because what you can be mindful of is what's called anterior humeral glide. And what's happening here is the humerus is shifting forward in the socket and pressing on that anterior capsule and stretching it out. Now what's going to happen is you're going to feel like there's a lot more instability there and tension. And what's happening is, as you stretch out that capsule, your body is going to tighten back down, because there's a reason that capsule was the size it was and had the amount of tension on it that it did. So if you're stretching out that capsule with very, very poor rowing mechanics, it's going to tighten down on that capsule, and you're going to feel like, ooh, I really need to stretch out my pecs. Why does my shoulder always feel tight? Well, that's kind of what's going on there. So just be aware of humeral head position, and don't allow your rows to excessively let the shoulder dip forward in the anterior capsule. Now, you've lifted, you're done, what's next? Well, most people just statically stretch. You're going to see a lot of people hanging out in gyms like this lady below, quote-unquote stretching. Everybody loves to stretch their hamstrings. This lady's getting a little bit of lumbar flexion actually out of this, so she's not really doing much for her hamstrings. But most people are going to be stretching after a workout. And there is a time and place for stretching. I do use it with some of my athletes. However, just like in the warm-up, typically what I recommend, or give my athletes the option of, is foam rolling. And there's a bit of research showing that foam rolling can be beneficial during the warm-up and during the post-workout period. So it's shown to be reducing arterial stiffness and improves vascular endothelial function. And this would be something that would be occurring kind of on a long-term time frame, not just initially within one session. So if we think kind of those metabolic byproducts, and we think back to our aerobic system and how that determines recovery, foam rolling may be beneficial if we enhance our vascular function after the workout to help remove some of those metabolic byproducts and initiate the recovery process. Very recent study shows that it reduces serum cortisol concentrations. Now, some may say, well, cortisol is beneficial after a workout. Why would we want to reduce that? Well, this is very early in terms of the initial stages of the research, but we also know that cortisol is a catabolic hormone. So as such, it may be beneficial to begin to reduce that cortisol concentration, and that's going to start that recovery process, as I mentioned earlier. We know that it improves active range of motion. There's a lot of research here showing that a initial bout of foam rolling can transiently improve active range of motion. As I mentioned earlier, it's essentially just resetting that central nervous system, turning off the tone of certain overused muscles, and as such, the length of those muscles is restored, so we get an increase in range of motion. And finally, we got to remember the influence that it plays on your autonomic nervous system. So what it may be beneficial for is shifting that athlete from a very sympathetic state to a parasympathetic state, and that's going to initiate that recovery process, help get them into a more relaxed mindset, help tone down some of those muscles that we've just worked, and get some of those other physiological benefits as mentioned above. So that's what I mainly would recommend with a lot of my athletes, and what I found very, very beneficial to help initiate them shutting down and just beginning to chill out a little bit after their session. So, all right, that covers the gist of things. If you guys have questions, comments, anything else you want to discuss or hear covered in further webinars, let me know in the comments section below. Drop anything you have down there. If you're interested, you can hit the subscribe button, follow along for more content that I'm putting out. But I hope that you guys have enjoyed this webinar. You've learned a few things, and you have better background on periodization, program design, and you can implement it now with your own programs and with other programs that you write for others. Thanks again for listening, and I hope that you guys enjoyed it.